Hello and welcome to today's lesson. Sorry, I had a little bit of a mishap. I just spilled water all over myself, but that's not very important. What we're going to do today is I am going to see just how much vocabulary you know when it comes to the dentist. Now, this is something that I think is very useful because we all do this, or at least I think we all should go to the dentist from time to time. If you're like me, then you probably don't enjoy going to the dentist, but I was there a few weeks ago, which is what really inspired me to do a lesson and talk about some of this vocabulary. Now, I know that many of you are very proficient. Some of these words you may already know, which is great. I'm confident that you'll learn maybe one or two new words that are not as common in just general casual conversation. But these are words that are helpful. If you go to the dentist and you need to talk about a problem that you're having, something going on with your tooth or teeth. And yeah, let's just go ahead and begin and see how much you know. And of course, I want you to participate in the lesson. Write your answer in the chat, in the comments, even if you're watching this later. I also want to mention, if you would like to get a copy of these lesson notes, just click on the link down in the description and you join our email community. If you're already a part of the email community, then I've sent them to you already and you can check your inbox. But I will throw that right there in the chat, that link, but it's also down in the description. All right, like the little smiley emojis. All right, so let's begin with I say must-know words and phrases because I think these are very common when you go to the dentist and the dentist is going to be telling you about things you should do or things you need to do. So I'm just going to give you the meaning and I want you to tell me the vocabulary word. What word are we talking about? And in this case, we're talking about damage to a tooth's surface. I'm having trouble saying tooths. Damage to a tooth's surface. So this, I kind of maybe giving a little bit of a hint, talking about just how common this is. But if you go to the dentist and they are checking out what's going on and you have some damage to that surface, they may tell you that you have this. What are we talking about? Damage to a tooth surface. And this, don't worry, don't think too much about the picture. And what I would say, I think the picture maybe makes you think of like a toothache, but really what we're talking about is decay. All right, great job, Lolly, nice, Yanyu. This is a word that could be either a noun or a verb. The meaning is the same. So I gave you a couple of examples down there. Your teeth have some decay. That is something a dentist might tell you. Or they could say, your teeth are starting to decay. That damage is starting to appear. But this is a common verb or noun that you may hear if you're at the dentist, and they may talk about decay that's happening. All right, then we have, now I think more of you will get this one, a damaged area in the hard surface of your teeth that develop into tiny holes. What are we talking about here? And again, I've already mentioned that this first part, these are words and phrases you need to know, very common. You go to the dentist, and especially if you're traveling in, whether you live in an English-speaking country or you're traveling in an English-speaking country and you may need to go to the dentist, this is very useful. So if we're talking about a damaged area in the hard surface of your teeth that they develop into these tiny holes, in that case, we're talking about a cavity. And I'm sure that, well, I don't know, I can only speak for myself over the years. Of course, I feel like I have had cavities from time to time. I think it's a normal thing that many people experience when they go to the dentist. They have a cavity, all right? If you have ever had a cavity, Hit that like button. All right, that'll let me know, kind of give me a sense of, okay, maybe, wow, a lot of people have cavities. So the next one is think about the process that we're following. Okay, the dentist says, yes, there is decay. Oh, you have a cavity. Now we need to treat that cavity. What are they going to do? This is used to treat a small hole or cavity in a tooth. So that small hole, again, it's just another cavity is another way of saying it. That's that meaning. So like I said, this is actually what the experience I had a few weeks ago. The dentist talked about decay, and they said, oh yes, there's a cavity, and we're going to have to do what? You need what? This is used to treat a small hole. In this case, we're talking about a filling. Nice, Julia, Lolly, well done. So once again, if you've had a cavity, then it's likely that you've also had a filling. And this is what it's called in English if you go to the dentist. And they may ask you stuff like, oh, how many fillings do you have? Or, they can tell when they look inside your mouth, how many fillings you've had over the years. So again, kind of going through that process, decay, cavity, filling, very common if you go to the dentist. So now you can look at the picture. The picture accurately represents the word or words that I'm talking about. This is a person who is trained and licensed to clean teeth, take dental x-rays, and provide related dental services and care. This is somebody who works, at a dentist office. It's not, the title is not dentist, but it's the other person or people, there may be 2 or 3 that also work there. What would you call this person? Generally, they do the cleaning, they take the x-rays. This is, again, what happened when I went in there a few weeks ago. I'm not talking about the dentist, but the person who I would say is helping out the dentist and doing some of these other activities. What would you call this person? I know everybody's thinking like you got dentist in your mind. I think a dentist is also somebody who's trained to clean teeth, take dental x-rays, but I'm not talking about that. The person who works with a dentist. So think about it like at a hospital, you have a doctor, and then the nurse would also take care of patients and help them. But it's not a nurse, because if we're talking about a dentist, well, in that case, we're talking about a dental hygienist. So a dental hygienist is the person who's helping out the dentist. They may end up cleaning your teeth. They'll do the x-rays. So again, this is a good phrase or a good phrase that you could know because it's a job that somebody may have, and they say, yes, I am a dental hygienist. And you also, just like dental school, you go to school. You have to go to school to become a dental hygienist. Okay, now this was actually in a lesson that I did a few weeks ago, unrelated to the dentist, because that is our topic today. But this is talking about the last tooth to come in at the back of each side of both your upper and lower jaw. And they are there. Sometimes they come in. A lot, I think often people get them removed. I know I had mine removed. And we're talking about what? And this is, sometimes you may have this conversation when people are talking about their teeth, when they're, especially these teeth in particular. We're talking about your what? I think you guys probably can guess this. So again, the last tooth at the very back, and sometimes they don't come in and you don't need to get them taken out. But if they do come in and you got to remove your wisdom tooth. So you could say, one would be your wisdom tooth, but in general, you have wisdom teeth on both sides at the very back of your upper and lower jaw, your wisdom teeth. Well done. So again, these are common words. This is useful vocabulary: dentist, decay, cavity, filling, dental hygienist, wisdom tooth. So the next part that I want to do, because we're going to switch it up as we go through the lesson. Again, if you're joining us, just write your answers in the chat, write your answers in the comments, because this is interactive English. It's all about participating and practicing your skills. Now I want you to identify the pictures. Simple enough. I'm going to show you the picture, and I want you to tell me, well, what is the word? What vocabulary word am I talking about? So here's the first one. Now, I don't want to give it away. I think you can look at the picture and tell, okay, this is what we're talking about. What word captures this picture right here? It's something that, again, everybody I think should do. The dentist for sure will tell you to do this each day, and they say you need to use or you could use it as a verb. You need to your teeth. So the answer is floss. Nice, Lolly, Manuel, Julia. So floss, it can look like this. You have those sticks with the string between there. That is the floss. Or it comes in a pack, and you just take the floss, wrap it around your fingers. That's what I do each night. And then you floss in between your teeth. So like I said, it could be a noun, and the dentist says you need to use floss, or you could use it as a verb, to floss your teeth. What are these? And this is something that people, like I had them when I was younger. And I think it's, I want to say it's fairly common. Honestly, I don't know. I'm a teacher. I'm not a dentist. But once again, when it comes to your teeth, when it comes to taking care of your teeth, this is something that you see. People have this. And generally, I think a lot of times when they're younger, but even when they're older, I've seen people have these. And we're talking about braces. Yes, you have braces. Elabel, Wally, Manuel, Vidya, great. So again, hopefully some of this may be new. I think a lot of this is pretty common right now. When we do that final part, I'm pretty sure there's a word or two you haven't heard of before, unless you're a dentist or a dental hygienist, then maybe you have. What is this? We're looking at a picture of what right here? And what I'm talking about is this liquid right here in the bottle that she's pouring into either the cup or the cap, maybe. I'm not really sure, but she's pouring it in there. And then I don't want to give it away. She's going to do what? But what is she using? That is also something that I think people use daily, again, in order to take care of their teeth and just practice good hygiene. So we're talking about mouthwash. Okay, she's using mouthwash. Nice. Eva, Yanyu, Tanya, okay, excellent. Then we have this right here. Now this one may be a little trickier. What's this? I'll go ahead and tell you that these are not real teeth. These are fake teeth, but people will use them. And I think in general, older people use these or will have them. Again, that's not always the case, but in general, somebody who's older may have what? And this is a picture of them right here. I kind of told you what they are. They're not real teeth. They're fake teeth. And you would say that you have what? See the answer in there. You're right, Lolly. So we're talking about dentures. So dentures are just, artificial, fake teeth. But again, people have them. They need them. I'm not really, again, sure what would lead to someone getting dentures, but generally speaking, older people may have dentures. And yes, they are not real. This is, I guess you could say it's a well, part of our body. It's part of our mouth, and I tried to find an image that captures what I'm talking about. So, what part of your mouth right there? She's showing you. I'm assuming. I think that may be a woman in the picture, but she's showing you her what? What are those in your mouth? And this is one of the reasons why I think people would also use mouthwash. They use mouthwash to really have strong, healthy what? And the word that we're talking about are gums. You want to have strong, healthy gums. And again, I think this is more common than some of those others, gums, mouthwash. I think these are things you hear all the time. You go to the dentist that they tell you things you need to do. You need to use floss. Try to use mouthwash. I don't know if you probably may not be talking about dentures. It depends on where you're at in your life and in the maintenance that you have to do with your teeth. But as Vicky and Gustav said, they cost $8,000. I did not know that dentures were that expensive. Okay, so the next part of this quiz is just completing the sentence. I'm going to give you the sentence. I'll give you the meaning of the missing word, and I want you to tell me which word goes in the blank. And each sentence, there are two of them. There are two missing words. So the first sentence, I was given some when I had a I was given some. This is it's the condition of not feeling pain. It's basically going to make the pain go away. And they may give you this if you're having a dental procedure that they're worried about, okay, this is going to cause the patient, this may cause some pain, so we're going to give the patient some what? When I had a, so this is a procedure used to treat infection at the center of a tooth. And I do think these words are common. And I actually was given some of this. I have not had this procedure down here. I may need it in the future, and I am not looking forward to it. I think everybody kind of get that first one again. To just take away the pain, we're talking about anesthesia, but that procedure that somebody may have, you're treating an infection at the center of a tooth. Claudio, well done. We're talking about a root canal. So I was given some anesthesia when I had a root canal. And I think depending on what you're having done at the dentist, they may give you some anesthesia, or you may ask for some if you're worried that it's going to hurt. And again, I think a root canal is kind of a larger problem. So in general, when you have those cavities, those tiny holes, you can get a filling. But if it's a little more serious, which mine it's heading in that direction, the dentist told me that maybe I may need to get a root canal. We'll have to see. One thing I wanted to point out is the pronunciation, anesthesia. It kind of is pronounced the way it sounds. The one thing that can be a little tricky are the two E's, because that first E, it's the schwa sound. It's an unstressed vowel sound. And that next E is the long E, because that is the stress syllable, that anesthesia. So that that is the stress syllable. So that's why I think it can be a little tricky, because both of those E's, that first one's the schwa, the next one is that long E sound, anesthesia. Okay. Root canal, good, all right. The next one, they took a during my I'm not giving you much help with the context for these sentences. So they took what? We're talking about an X-ray examination that captures the entire mouth in a single image. Okay? I guess I'll go ahead and tell you, what type of X-ray is that? So it has, it's a phrase. They took a during my, And this is, we're talking about the process used by dentists to carefully review your oral health. So this is a general meaning, but I'm talking about the process. This is what everybody would go in for. Like once a year, you go into the dentist for your what? And that is the second part right there. The dentist, they review your oral health. They're checking your teeth to see if there are any problems. But once a year, you're going to go in for this appointment. And that is that process of them checking carefully. So let's go back to the first one. I'm surprised. I thought these would maybe be a little easier. So we're talking about an x-ray again, the entire mouth in a single image. So in photography, you can do this as well. You start to the side and you go across and you get everything. And if you're putting it in a single image, well, then that is a panoramic x-ray. A panoramic x-ray. And that general checkup, you could just say like an annual checkup. You do it once a year. You could call it may be called an oral exam, a dental checkup, an annual checkup. There are different words that are phrases that you could use to talk about this just review that a dentist would do to see if there are any problems. But maybe you need to go into the dentist and you say, look, yeah, I just need to just come in for a dental checkup. And then they know what it is that they want you to do, a dental checkup. Excellent. Okay, here's the next one. Unfortunately, I had a tooth, so I needed a root canal. We just talked about that. After the dentist told me I would need a, so the first one, it is a noun. I had a tooth. We're talking about tooth as an adjective, but that noun is a pocket of pus that's caused by a bacterial infection. This is a really more of a dental word. It's not one that you may end up using in just casual conversation. You may, it just depends. But down here, I think this is another one that's a little more common when you're talking about that tooth-shaped cap. It's placed over a tooth. It's that covering. So what are we talking about here? Wow, excellent. Great job. Nice. Lolly, Elabel, nice. So that first one, we're talking about a tooth abscess. Unfortunately, I had a tooth abscess, and maybe you could hear about it because it's not just used when going to the dentist. You could use this anytime you're talking about like pus that kind of builds up and it's infected. I had a tooth abscess, so I needed a root canal, and then after, the dentist told me I would need a crown. So a crown is that cap that's going to go around that tooth to protect it, and you get a crown. Fortunately, I've only had fillings. I was a little worried when the doctor told me, or the dentist told me, oh, you may need a root canal. We'll see. But if that's the case, then who knows? Maybe I'll also need a crown as well. We'll see. Not looking forward to this. I told you I'm not too keen on going to the dentist. Then we have this next sentence. The dentist told me I had lost some tooth because of my teeth. Once again, that first one, the protective outer covering of your tooth, it's very specific. It's not a word that you're probably going to use just talking to your friends, whereas people, they talk about their teeth, they may talk about cavities or fillings or gums or mouthwash, floss, things like that. That next one's a little more specific, so maybe it's a new word, but this I would say is common. And you people would talk about this, the condition in which you gnash or clench your teeth. What is that called? So the dentist told me I had lost some tooth because of my teeth. And yeah, if you're doing this, then you may lose some of that protective outer covering. I always feel like when I say like, oh, this is a little more difficult word, maybe it's going to be challenging. Everybody seems to just, throw it down in there. It seems like you guys know that, which is great. So that protective outer covering, yes, is called enamel. Well done, Sarah, book. Olga, great. And that condition, which I said is common because I think some people do this, they have a habit, it could be a bad habit, and we're talking about grinding your teeth or clenching your teeth. I think more commonly people would use the word grinding. You're grinding your teeth. Sometimes this happens when people are sleeping and they end up grinding their teeth and they damage some of that enamel. Now, down here, I included the medical term for teeth grinding is called bruxism. But once again, I think overwhelmingly, you're talking to someone else, even the dentist, they may just say, grinding your teeth, or they may ask you, have you been grinding your teeth? Like, yeah, that's not a good habit. Try to, stop doing that. Something like that, along those lines. So there were a lot of words and phrases in today's lesson. As I said, I think some or many of them you already knew, it's always great to get that review because this is very practical. Wherever you live, or you're probably going to go to the dentist, or if you're traveling, especially in an English-speaking country, and you have a problem with your teeth, you may need to go to the dentist, and these are some useful words and phrases that you may need to use or that you'll hear the dentists use. So once again, if you want to get a copy of the lesson notes, click on that link down in the description. If you're a part of our email community, I'll go ahead and send them to you if you want to review and continue building your vocabulary. If you enjoyed the lesson, please hit that like button. That tells me that I should do more of these lessons. People are learning a lot, and it's always good to build your vocabulary. I want to give some quick shout outs. Thank you for joining me today. Lali, Manuel, Elabel, Victor, Gustav, good to see you. And yeah, I hope that with all of these lessons, I hope that you just learned something new. So have a wonderful day, and I will see you next time. So long.